Hello, everyone, and welcome to this week's episode of Recovery Talk. So, for this episode, I am joined by the wonderful Fiona Hollings to discuss autism and eating disorders. Fiona is autistic and in eating disorder recovery herself, and also is working to help roll out the so-called peace pathway within camps in the NHS. For my non-UK followers, essentially the NHS is our national healthcare system, and camps is the child and adolescent section. And the peace pathway is essentially a way to make eating disorder treatment more autism inclusive and autism friendly. Because, as we will discuss in this episode, there is a correlation between autism and eating disorders. And despite the fact that there is a high correlation and there's a high co-occurrence of these conditions, the eating disorder treatment very typically don't really take this into consideration, right? So the peace pathways is essentially working on making mainstream treatment more aware that yes, there is a high correlation here, and this is how we can make the treatment better for autistic people with eating disorders. It was a very, very interesting conversation, and I really loved hearing Fiona talk. So I hope you guys enjoy this as well and find some helpful insight. What I love about this conversation is that it is a very hopeful conversation, right? And I feel that sometimes people who have co-occurring conditions such as autism, oftentimes I feel like the treatment system almost gives a bit up on them, right? And think, oh, well, you have these comorbidities or co-occurrences, so recovery is not necessarily possible for you in the same way that it is for people who are neurotypical, right? But actually, as this conversation with Fiona shows, autistic people have unique strengths that can be utilized in recovery. And it's not necessarily that if you have another condition in addition to your eating disorder, that there's no hope of a recovery for you, right? Autism comes with its own challenges, but it also comes with some strengths that can be utilized. But in a neurotypical world, this is very often being overlooked. So let's get started. So I have Fiona with me here. Hello, Fiona.
Hello.
How are you doing? And thank you so much for coming on.
I am okay. I do really quickly want to say I am recovering from a chest infection, which is why my voice is a little bit husky. But I'm doing okay.
Yeah, that is. Yeah, I feel like everyone is sick right now.
Yeah, it's a lot going around.
Yeah. So thank you so much for coming on and for, wanting to touch upon such an important topic that I feel like is not necessarily spoken about that much, and that is autism and eating disorders. So maybe we could start with you just introducing yourself and a bit of, I guess, a short recap of your story.
Yeah, of course. So I got diagnosed with anorexia when I was 14, 15 sort of age. And I've been in recovery ever since. I've had periods where I've been in complete remission, and then I've had some nasty relapses. I'm currently doing really well, actually. But there was a lot sort of going on, I guess, behind the scenes in my eating disorder, and I think I was given different labels for what that was, and I spent a lot of time trying to figure out what that was. And then a number of years ago, we realized that there was a very high probability that I was autistic. And so I think about 3 or 4 years ago now, I had the autism assessment, referral for the assessment. And the waiting list is about 2.5 years at the moment. So it took
Wow, that's long.
quite a long time. Yeah. And then COVID came as well. So it was a very long process. Anyway, long story short, I finally had the last part of my assessment last year, and I got my autism diagnosis then. And I think for me, there was so much clarity and understanding that came from getting that diagnosis. And it's been so powerful and helpful for me in my recovery. Not that it necessarily changed anything, because I think when sort of my mental health, my eating sort of treatment team picked up that or I probably was autistic, like things were changed then. But actually for me, I think getting that diagnosis, helped me understand why I felt the way I felt,
Mm.
um, and why I felt the way I felt for such a long time. And it's been really powerful for me in my recovery. It's certainly helped me a lot. It's just helped me understand the mechanisms of why I feel the way I feel, why I process things the way I do. And it's also my job actually. So
Yeah,
I don't know if
yeah.
you've heard of PEACE, which stands, well, it's pathways for people with autism and eating disorders, pathways for people with eating disorders and autism through clinical experience.
Oh,
So
okay.
it specializes in helping improve eating disorder treatment for people who are autistic, making it more autism friendly. So it's something I'm very, very passionate about.
That is amazing. So I see that with autism. We know that there is a high comorbidity between autism and eating disorders, right? And
Yeah,
that it's very often missed. And especially it seems in women that it's more likely to be missed because there's a bit of a stereotype around autism that it is, something that only happens to boys and men, right?
yeah.
And what are some other common stereotypes about autism? And is that something that's prevented you from being picked up sooner?
Yeah, I mean, I was in the mental health system for a number of years before. I mean, there was traits that have been picked up over the years, but it took a number of years for us to take a step back and actually realize that adding all of those things together, it it was autism. There was all of these different things going on, and actually, autism explained almost all of them. And I think there is such a stereotype about what autism is, and I think this is why I'm quite passionate about talking about it, because
Mm-hmm.
I don't think that it's a stereotype. I don't think it is accurate for everyone's experience.
Mm-hmm.
And certainly my mum always says to me, like, I always thought autism was being non-verbal, not speaking, and, lining up trains and that kind of thing. And whilst
Yeah,
that might be some people's experience, for me, it wasn't.
exactly.
So for me, it was things like being very rigid in my routine and needing a routine.
Mm-hmm.
um, I really struggle to understand social situations, social cues. I find it very overwhelming and very exhausting. I really struggle with emotions, understanding the emotions I'm experiencing, understanding emotions in social situations, sensory sensitivity. So for
Mm-hmm.
me, noise has always been something that I really, really struggle with. And also textures of food, smells of food, all of those kinds of things. And
Mm-hmm.
actually, like having my understanding of autism now and having my diagnosis, I can look back at sort of the years I've had my anorexia diagnosis, and I can see that a lot of the times I have relapsed or struggled, it's actually been around times of big change in my life,
Mm-hmm.
which change is something I find extremely difficult to deal with, and that's my autism.
Yeah.
Um, and actually, change and burnout are my two, I guess, real vulnerability spots for my me managing my eating disorder.
Mm-hmm.
Um, which again is why having my diagnosis has been so helpful, because I now know that those two things I need to be really careful of.
Yeah.
And if I have a big change coming up, and or if I'm starting to notice that I'm feeling quite burnt out, actually me and my team are really, really quite astute to those cues and sort of like, okay, how are we going to best manage that to keep me going in my recovery?
Do you think that your autism has been a factor that's triggered your eating disorder developing in the first place?
I think it was a massive contributing factor. Yeah, I
Mm-hmm.
think for me there was I just felt like I got everything wrong. Like
Mm.
looking back at my childhood and being in school, I just constantly felt wrong. I felt like I didn't fit in. I didn't feel like I understood what everyone else was doing and talking about. And I just felt very yeah, like that feeling of wrongness was just everything that I experienced all the time. And I think for me, when the anorexia sort of came in, it felt like something I could get right.
Ah,
And
okay.
and therefore, like I it just, yeah, it felt like a way of managing the world and all the things that I didn't understand. I felt like it took me into my own little world and I could understand things in this world. It sort of
Mm,
it
mm.
put me in a bubble where, you know, my world became calories and exercise and numbers. And I could manage those things and I didn't feel able to manage them externally. Um,
Mhm.
and also managing, I guess, not just the way I was feeling, but things like my emotions, things like social situations. Um, and I think all of those things that I found so difficult to deal with, difficult to experience.
I think this is the thing with an eating disorder, right? Is that it will come into your life and present itself as a solution to something very real you're
Mm,
going through, right?
yeah,
And then, of course, the solution ends up, instead of solving anything, it becomes another problem that, puts you at serious danger, right?
yeah.
So I'm also very curious to hear a bit about, in terms of being autistic and being in recovery. I understand there are some unique challenges, right? But
Mm.
are there also some strengths? And what are the some typical strengths and challenges for an autistic person in recovery that maybe they should be aware of, maybe treatment professionals should be aware of?
I mean, definitely. And this is, I want to start off with strengths actually, because this is something that I'm really, again, quite passionate about, is I think there is a sort of a misconception that people with autism and an eating disorder can be more complex to treat. And I actually think for me, I've used the strengths of my autism to help me overcome my anorexia. So for example, I need a routine. I need to know what's coming. And actually, for me, having a plan makes me feel more in control. It makes me feel calmer. And that's related to my autism. That's how I've always been. But so, for example, in my recovery, what I use is a plan. So I plan the week, I plan what I'm going to have, what I'm going to eat, what I'm going to be doing. And that actually works really well for me because it gives me that sense of predictability and familiarity. And I think things like that, I think, you know, if someone needs a plan, then use that to help them recover.
Yeah, I really, really loved what you said there with the strengths, right? And I see this when I work with people with eating disorder. A lot of the work we're doing together is often, basically planning in recovery, planning in
Yeah.
challenges and all of these things, which can be a very helpful tool. And I was thinking, could that be maybe something where an autistic person may have an easier time actually sticking with those plans, right?
Yeah, and that's something that I've experienced is actually once it's written in a plan, I will do it.
Yeah.
Like I'm very good. I'm a habitual person. Again, that's part of my autism is if I do something a certain way, I will continue to do it that way. So for me, establishing that routine and establishing that sort of recovery focused plan was really beneficial because it gave me it gave me that predictability and that understanding and that okay, this is how I know I need to approach things. But it helped me recover. You know,
Mm.
it helped me get into a healthier place. It helped me keep in a healthier place. And this, I guess, sort of goes into some of the challenges that I face in recovery to do with my autism. So for example, I really struggle with hunger cues, and that's because I have poor interoception and things like that. And that's something I've struggled with for an awful long time, as in before my eating disorder came. And that's very common in autistic people. And therefore, for me, having that plan again, it enables me to keep on track, to keep healthy as well,
Hmm.
where I think there's sometimes quite a kind of an expectation that reach a point and suddenly my life become incredibly spontaneous and all of this kind of stuff. And this is something I found really difficult is I think that there is an expectation. I think I had to adjust my expectations for what my recovered life is going to look like because I'm never going to be a hugely spontaneous person because I find that very difficult. And I will always need some sort of plan and some sort of structure, but actually being okay with that and knowing that if I've got a plan and a structure that is keeping me healthy, then that's okay.
Well, that is very interesting points. And you said something there that I think leads me a bit to another point that I really wanted your thoughts on, right? So, for example, you mentioned, having a bit of a difficult time telling your hunger signals, right? Which we know is very common in autistic people, right? And also things such as, routine, being more, more of a routine person, less spontaneous. We know these things are common in autistic people, yet we also know that in some people with eating disorder, that can be a secondary trait, right? So it's something that the eating disorder brings out or strengthens, right? And how can people tell the difference between what is the autism and what is the eating disorder?
And this is quite murky water.
Yeah.
It's something that we talk about a lot at work actually. And I think it would be wonderful to present two lists. This is eating disorder and this is autism. But they overlap and it can be difficult and this is where it will be difficult for a lot of people. But certainly for me, I think having the understanding of being autistic has enabled me to understand where that overlap happens. And this is why I'm really, really actually excited about the fact that more people are recognizing they're autistic and are getting their autism diagnosis because that can start their journey of working out which is which, because it will be different for everyone. But something that I talk about a lot is actually it's really important to go back and look at what what you were like before your eating disorder. Um, so in an autism assessment, they look at your childhood because it's a neurodevelopmental condition. You have to have had these traits from childhood. So understanding what is what was there before the eating disorder and then what maybe is exacerbated by the eating disorder because there's a quote by Pookie Knightsmith and she sort of talks about an eating disorder being like autism on steroids. So I know that when I've been very unwell with my anorexia, all of these sort of the cognitive rigidity and all of that kind of stuff was was that much more intense because of the eating disorder as well. And for some people it eases and it might be related to, the acute malnutrition, and for other people it remains. And I think this is where it's really important to be able to be in a better nourished place to work out whether that is related to malnutrition or if that is related to the autism. But also having a curiosity about, okay, if this is something different, how do we manage that and how do we understand that? And something that I've been quite, I guess, quite strict with myself with, but also my team have been quite strict with me with, is that recovery from my eating disorder is non-negotiable. So, I need to eat a certain amount. I need to eat enough to restore weight, to maintain my healthy weight and all of these kinds of things. But the flexibility comes in with how that process is done, I guess. So for example, I've never eaten a humongous variety of food. That's because I have sensory sensitivities to different foods, textures, smells, and that kind of thing. So it isn't a priority in my treatment to be eating a humongous variety of food. But it is absolutely necessary that I'm eating enough food. So the flexibility comes in with, okay, because of my autism and because looking back, before my eating disorder, I was never eating a humongous variety of food. There's less pressure to work with a humongous variety of food that just isn't, that's not how I function. That's not how I've ever functioned. But actually, what's non-negotiable is I will eat enough and I will restore my weight and then maintain a healthy weight.
Mm-hmm. See, that's a very good point. And I think so often when it comes to topics related to eating disorder recovery, we want like yes or no answer. We want to know exactly what is the eating disorder, what is this, what is that, and we want to categorize and figure out exactly which is which. But the truth is sometimes we won't necessarily know until we are at the healthier space. And I think, I guess this is part of it, right? To figure out, am I autistic? Being to a fully nourished state puts you at a point where you are at a better state to actually figure these things out and taking out other factors that could contribute, such as the eating disorder, right? And actually, you made a good point that looking back, how was I before the eating disorder, right? Because autism is something that starts in childhood, right? How was I behaving before that, right? Can also give a very realistic insights, right? And setting expectations accordingly, right?
It's really interesting actually because the peace pathways were rolled out in the Maudsley Hospital in London. And within this, they sort of made sort of autism friendly treatment options. And what they found is that it actually benefited people who weren't autistic as well.
Okay.
So, they're at the acute phase of malnutrition, and actually making these adaptations also benefited those people. So I kind of come from the perspective that if someone's struggling with this in quite an acute way, actually managing that situation can enable them to move forwards later on. And I've been going through recovery sort of, fairly recently. Me and my nurse sort of talk about, when's the right time to work on different aspects. And for us, a priority was getting my nutrition level up to a really good amount every day, restoring weight, reaching a healthy weight, and then maintaining it. And actually working on the flexibility around that later on, once we knew that, I guess, the really intense effects of the malnutrition and things like that were starting to reduce. And it's something that I've actually found really helpful because when I think I know in recovery you have to trust the process. You have to trust that it does get better. And when I was in quite a low place recently, quite a dark place, and sort of last year, and I sort of thought, I don't know if this is ever going to get better. But I kind of, you have to have that blind faith that people tell you that it will with time and with nutrition.
Key. Yeah.
And, I remember telling myself, if I keep on going with this, if I keep on repeating this, if I keep on repeating eating enough, going against those thoughts, making those recovery focused decisions, I have to have this blind faith that it will get better. And it did. And not only did it get better, I got into a place where then I was thinking clearer and I could start considering doing all these other things. And for me, that's when we, started to incorporate more flexibility with what I'm eating. Granted, not a humongous flexibility, but that is because that's my autism. It's kind of understanding where one ends and the other starts. But certainly I'm in a place now where if I feel able to, I can. And that's been really important to me.
Yeah, I think the point you made there with, food first, right? That is something so important. I guess that would be not just for, autistic people in recovery, but also just everyone. That's always the approach that I tend to work with, that you're not you when you're hungry, right?
Yeah.
Sorting out the acute malnutrition is super important. Yes, the rewiring part as well. It's so important to, of course, challenge and all of these things. But sometimes people think that they can recover through just, oh, I'm just going to challenge my rigidity a bit, challenge some fear foods, but they don't actually fix the acute malnutrition and potential
Yeah.
also being under your set point range, right? These things must be fixed. These are unavoidable, non-negotiables of recovery, right?
Yeah. Yeah. And that's definitely that's the approach that I have taken, where it very much is sort of, I know that I know I have challenges related to my autism, but the non-negotiable is getting to a healthy place, remaining in a healthy place.
Mm.
Um, and actually that's been so helpful for me because it's taken away that sort of, I don't know, that worry that the eating disorder might sneak back in.
Mm-hmm.
Um, where I'm sort of like, it doesn't matter if I'm having a bad day, I will still eat the same amount. And again, this is where my autistic brain is actually really powerful for me in my recovery, because even if I'm having a really bad day or a bad week, I stick to my routine, and that can be, it can be my safety actually.
Yeah.
That can be my safety against the anorexia.
Yeah. That is, it's like almost like everyone in recovery can learn something from autistic people in recovery in that sense, right? These
Yeah,
are tools that could work for everyone.
and they absolutely can.
Mm-hmm.
And I think there's so many things that I've sort of learned on my journey, and it's quite interesting because whilst I've had relapses in the time I've had my anorexia diagnosis. So I had quite a horrible relapse about, I don't know, 18 months ago, 2 years ago. And coming out of that relapse this time is the first time I've been through recovery with the understanding of being autistic.
Mm-hmm.
Um, and me and my parents are very reflective at the moment, actually, on how different it's been for me, and how a different place I'm in, and how much more of a stable place I'm in. And I think that stability has come from, okay, what do I need fundamentally to keep me in a good place? For me, that is a plan. You know, that is a plan, and actually being entirely okay with, I just need a plan. And that keeps me well. And that's okay. If that keeps you well, it's okay to plan things out. And I'm not just talking about food, we plan the week. So every Sunday evening, we sit down and we get a week planner out, and we plan what we're going to do, when we're going to do it. And it helps all of us, to be honest.
Mm-hmm.
Um, but for me, it helps me know what's coming. It helps me know what to expect. It doesn't give my anorexia any wiggle room to sort of take over.
Mm-hmm.
Um, and and it makes me feel comfortable, and in that it makes me not need my anorexia. Does that make sense?
Yeah, that makes sense. I think the things you're saying are so important, and I wish just that every treatment professional could hear this, because I think very often there is a bit of a thing amongst treatment professionals that when someone has, any other, comorbid diagnosis, especially something like autism, which is, obviously like a permanent thing, right? They immediately think, oh, that is a difficult patient. That is a patient that somehow, oh, it wouldn't work for them, right? And they almost give up a bit. But instead,
Yeah,
seeing that actually, if you actually utilize it as a strength in some ways, there are things about the autism that can be used in recovery, right, as strengths and as tools, and even tools that people without autism can still benefit from, right?
definitely. And I think that there is a fear when autism is mentioned, between professionals and people. When autism was first mentioned to me, I thought, oh gosh, like I don't know, I don't. Again, I had a stereotype, and it was entirely wrong. Um, and understanding the spectrum has been hugely helpful to me, because I've
Mm.
understood the different presentations that autism is. And I also think in treatment there is sort of like, oh well, for me, I was labeled resistant, non-compliant, and all of those kinds of things, where I was struggling and actually, I was struggling, when I was in hospital with the noise of a very small dining room with lots of people in it, with a very cluttered room. And, in the dining room, there was a big oven thing that kept all the food warm, and it had a big light on it, and it made so much noise. And
Mm,
to me, that was a sensory hell. It was so distracting. I felt so overwhelmed. And actually, when I came home from that admission, and I was doing better at home. That's why I did come home, because the environment was easier for my autism. But this is where if you've got someone who is autistic, possibly autistic, small adaptations can make the biggest of differences for that person. So thinking about, the micro noises in rooms that I pick up on that other people don't, but they make a big difference to me. Ticking clocks, buzzing lights, all of that kind of stuff. That can put me into an overwhelm sensory wise. So just taking out the ticking clock,
yeah,
you
take
know,
out the clock.
yeah, thinking about having all the keys jingling round,
Yeah,
just putting fobs on keys so that they're not making so
yes,
much noise.
exactly. And again, I think these kind of adaptations are things that, of course, they will greatly benefit the autistic person in the room, but also the neurotypical people in the room won't take
Yeah,
damage by there not being bright lights and ticking clocks.
definitely.
Again, these adaptations aren't things that, necessarily harm anyone else. So like, then why not,
Exactly.
right?
Yeah, and thinking again, there's about, because obviously for me, like I've been in therapy quite a lot, and something that I used to really struggle with was actually like intense sessions where there was lots of sort of direct questions and that kind of thing. So also just different ways of communicating.
Mm,
So
interesting
actually,
point.
if you look at the Peace website, they've got some absolutely fantastic resources, but one of them is a communications passport.
Hmm.
And it's actually understanding how you best communicate with other people. And for me, I communicate best through writing. So if I can attend a session and I can frequently become quite overwhelmed in the session because there's a lot of information. I struggle to process that information, quickly, or be able to give a response quickly. And I can frequently go quite quiet. But it's not that I'm not listening, and it's not that I'm not being non-compliant. I just take time to process what's being said, and actually to come away from a session and to write down how I'm feeling and then send that over. That works so well for me. It's quite a small thing, but
Hmm.
you know, to me, that is me engaging in a session, is if I'm given a bit of time and then I can write it down and then send it over, and then we can discuss it next session. And actually this is what my team are really good at. Um then, if I'm feeling very, I'll sort of say I'm going to go away and just need to write things down, and I need to make sense of things, and then I send them over, and then sometimes my team write back to me. Really helps me as well, because then I've got it on paper what we've spoken about and what the expectations are and where we are in treatment and what's coming next. Um, and something else that my nurse sort of does with me is he'll prepare me if something's coming. So, sort of in 3 weeks' time, you will need to make a change to your meal plan. And that's okay. That's given me time. I know what the expectation is. Again, this is where it's really boundaried with there will be an increase, but I'm giving you time to process it. Um, or at the moment, we've got difficult conversations coming up. So he sort of said to me, you know, in April, we're going to have a difficult conversation about, bodies and, hunger cues and all that kind of stuff. And that really helps me as well. So I can sort of prepare myself, okay, this is what I need to start thinking about. And this is how it just, it helps.
eating disorder treatment, I think per default should be more geared towards understanding autism and being more autism friendly, I guess would be the better word. But just by default, because there is such a high, I mean, would you use the word comorbidity? Because I feel like comorbidity implies illness. So I don't know if that's the right word, but
it's co-occurrences generally.
co-occurrences, that sounds a little bit, less medical, right? Because the co-occurrence is so high. Especially, I think I read somewhere that the co-occurrence in especially long-term anorexia and autism is something like, I think 40% was the number, but I just know that it's really, really high, especially amongst long-term eating disorders, right? I just think that when you have the co-occurrence is so high, the treatment should per default be autism inclusive, right? Not saying that it shouldn't be if there's a lower co-occurrence, but overall, I just think that is something to keep in mind of, right? And I hate this thing of non-compliance in general. I just hate that term, or non-cooperative client, right?
Yeah.
Because instead of then seeing, okay, how come this type of treatment format is not working for this type of client, and instead of investigating the system, it puts all the blame on the person, right? And they could then again be that, yeah, this person is not responding to this type of treatment because this type of treatment is designed for neurotypical people, right? Again, I think this is such a big mistake I see, and something that frustrates me so much I see in the healthcare system, is that whenever someone does not make the so-called expected progress with the traditional treatment, they immediately blame the person rather than thinking, oh, maybe there could be, it's making some adjustments to this treatment could help instead, right? And that's why I think the work you're doing is so, so, so important.
Yeah, and the co-occurrence is so high, and you're right, it does seem to be even more so, or I don't know if it just gets picked up after a certain amount of time, but in people who have been struggling for longer. And the narrative of their experience is treatment not working. And I sort of, it is this, non-compliance and being difficult and all that kind of stuff. And I can't stand that language, because I don't think it is. I think if you've got this many people who apparently treatment isn't working, maybe we need to look at the treatment. Maybe we need to understand how introducing flexibility in the style of treatment, like, for example, different ways of communicating, that could take, that might be why someone's really struggling in a session, because they're struggling to process what's being said quickly enough, or knowing how to process how they're feeling, or they don't know how they're feeling. And these are all things that, for me, are explained by my autism. And actually, but equally, it shouldn't be that you always need sort of a diagnosis to explain that. I think there's so many people that, struggle in treatment full stop. And again, yeah, let's look at the treatment. Let's look at how we can reasonably adjust treatment. And again, keeping really astute to the anorexia and the eating disorder, the recovery is non-negotiable, but the path to recovery can be flexed.
Exactly. Yeah. I think this is, and I would like to hear your thoughts on this as well. That thing you said with recovery being non-negotiable, I really, really love that, because I find that kind of approach seems to help people so much, autistic or not autistic, right? Sometimes I find that within treatment professionals, that approach isn't always adopted, where treatment professional gives almost some leeway to the eating disorder, right? And then instead keeping a very strict, like, no, recovery is non-negotiable. No, you can't do that. Instead of, especially see this among people who've had eating disorders for a long time, where the treatment professional almost accept, oh yeah, you can stay at a very low intake or at a very low weight, right? Okay, well, almost like they label you as non-compliant, and therefore they accept that. They accept you essentially staying at a state that is very harmful for you, right?
Yeah, and I think it's quite a dangerous position to be in, because I don't think, like, for me, treading water isn't possible in recovery. If I'm not moving forwards, I'm moving backwards. I can't I can't just do some eating disorder behaviors and not others. So kind of, if I had the message, oh well, get to a certain point and then you're fine, you're not great, but you're fine. To me, that's a really mixed message, actually. the eating disorder is really not good, so you need to get better, but don't worry about getting fully better because for me that noise will still be in my head. And that's something I've really noticed this time going through recovery. And I'm currently in a really, really strong place. And I think that is the attitude that I've had with my recovery, but also my treatment team have been so consistent in their message, where it's sort of like, no, we will get better. And the way we do that is through having enough food and working through those cognitions and working through eating disorder behaviors to be able to sort of lay that really solid foundation that I can then build on.
That is so key. And again, I think that is something that could benefit also people without autism, right? So I think we
Definitely.
all got a lot to learn. And I have definitely learned so much. And it made me think also, how can I, adjust better, right? Make my own approach more autism inclusive, right? So I
And
think so
I
many interesting points here.
and I think this is where it's sort of they're not big things to do. Like it can be such minor adjustments, like asking someone, how do you best communicate? Is it easier for you to write down how you're feeling and send it over to me? Or do you prefer talking about it like on the spot and things like that? And there's the other sort of aspect that I think is really important is actually, did the eating disorder develop to help someone who is neurodiverse cope in a neurotypical world? The world is not set up for people who are neurodiverse. There's expectations, there's pressures, there is the assumption that you understand everything that a neurotypical person does. And for me, that leaves me feeling really overwhelmed, burnt out, and oh, I don't understand it. I can't do this. And
Mm,
actually knowing that that's my autism, it just allows me, it stops me being so angry with myself. It
mm.
stops me trying to sort of feel like I need to be someone that I'm not.
Hmm. Yeah, it reminds me of something you wrote on your Instagram where your doctor said there is nothing wrong with you. You're just
Yeah.
autistic, right? And I
Yeah.
thought that was so profound, right? And I think, and I wonder, I think as a society, a lot of us kind of have been taught to view autism as almost like a disease, right? Or like, but again, thinking of it as it's just a different neurotype. It manifests differently in different people. People are going to have different challenges, right? Autistic people, they don't necessarily all look the same or have the exact same challenges, right?
Yeah, and autism isn't wrong,
Mm,
and I think for me, sort of when I got my diagnosis and that assessment, and the psychiatrist said, like, there's nothing wrong with you. You're autistic, there's nothing wrong with you. And
mm-hmm,
I think, I'd had diagnoses across the years. I think, like, also being in treatment for anorexia across the years, you are told there's something wrong with you, and there was, when my anorexia is an illness that I have, but my autism isn't an illness. My autism is just, that's my perception of the world. That's my way of processing the world. And that's never going to change. And actually, I celebrate it now. You know, I'm
mm-hmm.
autistic, I'm different. And how boring would the world be if we were all the same?
Exactly. And that is so wonderful, right? That's such an empowering view as well, right? And I guess that it is a problem that a lot of autistic people are misdiagnosed with a lot of other diagnoses that don't necessarily quite fit.
Yeah.
For example, especially I know, especially women are disproportionately autistic women are misdiagnosed with personality disorders, just for example. Not saying that personality disorders aren't real anything, they very much are right? But
Mm.
very often I think because there's so many stereotypes about autism and how it looks like and who it affects, a lot of people are missed in the system, right?
Definitely. And this is where I do talk about my autism and how it presents for me and the difficulties I've had, but also the strengths I have because I was misdiagnosed with a number of things over the years, and for me, they all felt like weights. They all felt like this is a thing that's wrong with me, but it never explained things for me.
Mm.
Never was like, oh, well, that's why I feel like this. It just it wasn't right. And when I got my autism diagnosis, it felt like a weight off my shoulders. It was like, oh, so this is how I feel. This is why. And it felt like I mean, I still to this day, I'm like, oh, that's why. That's autism. That's why. And it is, it's everything I felt my entire life. And it's been more helpful than I can understand than I could ever sort of say.
Mm-hmm.
And actually just, okay,
Yeah. Yeah.
this is why. And actually there's nothing wrong with the way I perceive things
Yeah.
and the way I understand things. And yeah, and my parents love the quote, why try and fit in when you're born to stand out?
Exactly.
Um
That's so
and
beautifully said.
yeah, I
Yeah.
just
Yeah. That's wonderful. And I think this is because I very often hear narratives where people are like, oh, like why does it matter? Like, okay, why does the diagnosis matter? Why does it matter to know if you're, for example, if you're autistic, right? But actually, and I think sometimes people are scared that if you get diagnosed, are that going to harm you in some ways, right? But
mm,
then actually seeing that a diagnosis and figuring yourself out in that sense can also have its benefits if you can use that information to find out, okay, this is why things haven't worked for me in the past. And this is how I can understand my weaknesses and also understand my strengths and use them in a productive manner, right?
definitely,
I think it's been a
definitely.
key takeaway from our conversation, right?
Yeah, yeah. And actually part of work is we always sort of say, be curious about autism. You
Exactly.
know,
Yeah.
be curious about if the person that you're working with might be autistic, just asking those questions and that comes from a broader understanding of what autism is.
Mm-hmm.
So these are all things they're going to take time to change. Tackling those stereotypes, tackling those assumptions that people have. And for me, when it was first brought up, I didn't know what to think about it. I sort of was, I don't know. And then went away and did some reading, and I actually read a book. It was nothing to do with eating disorders. It was just a girl's experience being autistic. And I felt so moved by it because I was like, this is how I feel. This is how I felt my whole life.
Mm.
And it was sort of like, I don't know, like things fell into place. Like it didn't change anything, like nothing externally changed, but something huge just made sense in my head where I was like, okay, this is it. This is why. I get it
Mm.
now. And it stopped me being so angry with myself.
Yeah. Yeah. Like a tool for you to understand yourself better
Yeah,
and maybe a tool in terms of treatment to see what is working and what is not, right? So again,
definitely.
a diagnosis is not necessarily like this bad thing, right? Because again, I think we have, again, a lot of bad views around diagnosis. Like it's like, okay, then you're officially sick, you're officially broken in some ways. But actually,
Yeah,
again, it can just be a tool to understand. So yeah, I've really enjoyed this conversation. I've literally just been sitting like quietly nodding, just been like nodding along because it's been so interesting to listening to you talk. And I really hope that someone will listen to this episode and maybe they'll be like, aha, that makes sense. Or maybe someone who is autistic listening to this being like, oh, there are, I'm not necessarily broken. Again, there are certain small adjustments that can be made,
yeah,
make the
yeah,
treatment more autism friendly. And there are also strengths in it. You are not
yeah,
broken or hopeless just because you aren't neurotypical, right?
yeah. And I think my sort of takeaway message would be just be curious about it.
Yeah,
Just,
exactly. Be curious. Yeah. That is amazing. Thank you so much for being on. I mean, we could have just kept going, but it's already
Thank
been
you for having
a
me.
long episode. Thank you so much. And where can people find you and your work?
So I talk a lot on my Instagram, which is finding underscore fee underscore um, about autism and eating disorders, and also on my YouTube channel, which is Feast Fight Back.
Great. Wonderful. Thank you so much for coming and for sharing your insights. I've really enjoyed this.
Thank you so much for having me.
I hope you guys enjoyed this conversation, and you can also check out the Peace Pathway at peacepathway.org.